I want to welcome everybody to another Medical Professionals webinar. I've done a few of these now. This webinar is approved, as Sarah said, for 2.5 CE credits. Is it 2.5, 2.5? I'm sorry, by ASRT. It's also approved for CQR requirements. Today's webinar, we're going to talk about saturation techniques in MRI. All right, so without further ado, I'm going to get started on the next slide. Of course, the objectives of the course. So upon completion of this webinar, attendees should be able to define the term suppression as it relates to MRI imaging, list the different tissue types that are commonly suppressed in MRI, and explain two very common saturation techniques, fat suppression and fluid suppression. You should be able to define saturation bands and list and explain various ways that the saturation bands are used. In this webinar, we will discuss what it means to suppress tissue in MRI and review the general physics behind that technique. We will work our way through different fat suppression techniques such as inversion recovery, spectral fat suppression, and we will also learn what that is, what the chronogram looks like for each of these, the disadvantages and the advantages of each type of technique, and how each is applied clinically, and provide some examples. We'll look at some pictures, some images, and look at some examples of the various suppression techniques. We'll finish up the evening with the fluid suppression and discuss the use of saturation bands. The ability to suppress various types of tissue is a principle of MRI that sets it apart from all other imaging modalities, particularly the other cross-sectional modality, CAT scan. In MRI, we have the ability to use our parameters to basically turn off or suppress the signal from tissue we don't want to see in the image. So why would we want to do this? In MRI, during T1 and T2 relaxation, different tissues have a different relaxation time. For this reason, during a T1 sequence, fat will appear bright. During a T2 sequence, fluid will appear bright. When the suppression techniques are used, the brightness or intense signal can be removed or diminished so that it's not so apparent on the image. The problem with these intense signals is that pathology or different types of conditions can be hidden by the bright signal. In addition, a differential diagnosis is possible when we suppress the certain types of tissue. For example, fat saturation during skeletal imaging will allow for the differentiation between fat content of bone versus a response to the injury. The fat will suppress, but the fluid from the injury will not. Here are two examples of suppression techniques. The image on the left is a coronal shoulder with fat suppression. Fat suppression is used often when imaging skeletal work. By suppressing the fat content within the bone and within the joint space, bright signal from pathological fluid can be seen. An example would be a small fracture. MRI is not the best imaging modality for bone, and at times these small fractures cannot be seen, but the hematoma or the fluid response can be seen. The second image is the brain. This sequence is utilizing water or fluid suppression. The brain has a lot of fluid content. This fluid can hide small pathologies. By suppressing the bright signal from the fluid, we can see the signal from smaller pathology that might otherwise be hidden. We will be learning several different techniques for fat and fluid suppression. But first, there are some general principles to review. If you recall, in MRI, the signal used to create an image is based on the magnetization of the hydrogen protons. Hydrogen protons are present in large quantities in the fluid of water, organ parenchyma, and fat. As we see here, water is the most abundant of the three. During the course of evaluating tissue and pathology within the body, It is useful to be able to differentiate the signal of the various tissues. Water and fat can at times prevent certain types of pathology from being seen within the parenchyma because of the intense appearance of the tissues on certain pulse sequences. Also recall that relaxation times of fatty tissues for T1 and T2 are very short. For this reason, fat signal appears hypersignal during T1 weighted sequences and intermediate signal or a medium signal during T2 weighted sequences. Fat signal can be annoying in some T2 weighted sequences, creating difficulty in separating fat from the other tissues. In addition, fluid signal appears to be in hypersignal during T2 weighted sequences and dark on a T1 weighted sequence, which can mimic or cover up pathology. There's really only one way to suppress fluid. We will discuss this technique on its own later in the module. For this reason, this section is dedicated to just fat suppression or fat saturation. As an example, the images on the slide show that fat regains longitudinal magnetization rapidly during T1, thus giving it the bright appearance as we discussed above. Again, fat signal can be annoying in some T2 weighted sequences, creating difficulty in differentiating fat from other tissues. Here we see that fat will lose its magnetization more quickly during T2 decay, while water dephases more slowly. Both, as we know, are time-based. The greater the TE and TR time, the more time the fat has to dephase. So what does all of that mean when it comes to the appearance of tissue on the MRI image? On this slide, we can see the difference in contrast between fat and water in both T1 and T2 sequences. This means that fat will appear to have hypersignal or be bright on T1 weighted sequences and will have an intermediate or a gray appearance on T2 weighted images. This is because of the differences between the contrasts of the fat and the water, as it is shown here on the graphs. Saturation techniques are mostly dependent on the resonant frequency of fat versus that of water. Fat resonates at a range between 3.3 and 3.5 parts per million, lower than the frequency range of water. There is some amount of water, I should say, in lipids or fats. The frequency of fat is different than that of water, mostly because of the alkenes in the fat molecule. This results in the difference of 214 hertz lower frequency of fat compared to the water when placed in a 1.5 Tesla magnet. Remember, spin frequency or gyromagnetic frequency is always magnetic strength dependent. For that reason, in a 3 Tesla magnet, the frequency shift would be twice as large. Another way to say this is if the magnetic strength is doubled, the fat-water frequency difference is also doubled. We will now examine another way to cancel the fat signal by saturating it. Let's again look at that water molecule and the fatty acid molecule. It can easily be seen that the molecular environment of hydrogen atoms is very different between the two molecules. This is why, in reality, hydrogen atoms do not all rotate at the same velocity when subjected to the same magnetic field. In other words, the gamma of the hydrogen atom of water is not exactly the same as the gamma of the hydrogen atom of fat. When we click on the next button, we can see that the representation of signal strength versus rotation frequency. By convention, the reference is the rotation frequency of hydrogen atoms, and the unit is in parts per million, or ppm. This representation enables us to be independent of magnetic field strength. The difference in rotation velocity between protons of water and of fat, in this case, is always 3.4 parts per million. This value expressed in hertz is proportional to the intensity of the magnetic field. At 1.5 Tesla, this difference is 208 hertz. The higher the field intensity, the greater this difference, and the easier it is to differentiate the two. The basic principle in MRI states in order to obtain resonance, we must have a radio frequency to match the rotational frequency. If we emit a radio frequency with a narrow emission bandwidth that is only the resonance frequency of fat, only fat will resonate and be flipped. For demonstration, we have chosen the simplest sequence. Just before the standard sequence, we will apply a selective 90-degree pulse centered on the resonance frequency of fat. Only the hydrogen atoms of fat will resonate. Fat protons are flipped 90 degrees and water protons remain in their steady state. As we can see here. The normal sequence then starts. The RF pulse covers all frequencies of the section or provides a broader bandwidth. All protons start resonating and are flipped 90 degrees. Fat protons are at 180 degrees and water protons are at 90 degrees. Fat protons have no transverse component and will therefore not give a signal. This involves a 90-degree flip, or a fat sat for Siemens, a 60-degree flip, classic fat sat, or 90-degree fat sat for GE, and a 100 to 110 flip, or SPAIR, SPIR, for Philips. But the underlying principle is always the same, regardless of the degree of flip. There are other methods to cancel the fat signal that involve the selective excitation of water. These techniques are dealt with in a more advanced course. This is an example of fat saturation. Fat sats are common on extremity imaging, as I've mentioned. Removing the fat around the joint and from, around, and within the bone allows us to see things that might otherwise be hidden. Additionally, it can help with diagnosis. So notice the bright signal just below in the humerus, just below the anatomical neck. The fact that we can see this on a fat sat tells us that it is pathology. We know from earlier modules that fat sat will show up bright on a T1 sequence. If we have saturated the fat, pathologies that show up bright are then known to be real pathologies. What type of pathology exactly, we don't know, but we know that it's not supposed to be there. Now that we have reviewed the basic principles of saturation and suppression, we will review the various methods of suppression and also discuss some of the more popular techniques in detail. While all vendors have their own unique names for techniques that are used, there are some very common basic terms, and the principles behind them are the same. Anyone who spends any amount of time in MRI has probably heard all of these. And if they, even if you haven't, you will know what they are, okay? These are IR. IR stands for inversion recovery. A common inversion recovery technique is STIR, S-T-I-R. I'm sure everybody's heard these, right? Next is spectral fat suppression, which is SPAIR, SPAIR, which is a combination of IR, the inversion recovery, and the spectral fat suppression. Another is Dixon Technique, DIXON, and the use of water excitation to suppress fat. There are two basic classifications of fat suppression techniques available. First are those techniques based on T1 relaxation time of fat, and those techniques based on the different resonating frequencies of hydrogen, which are tissue dependent. T1 relaxation time techniques are limited to inversion recovery techniques. This particular inversion recovery is called STIR, S-T-I-R. STIR stands for short T1 inversion recovery. There are so many acronyms in MRI, but each letter means something that defines the sequence. The other technique mentioned was using resonance frequencies of the tissue, in this case, water and fat, to suppress the fat. This, as you may recall, describes using chemical shift concepts. Examples of this are spectral fat saturation, water excitation, and Dixon techniques. As we mentioned, we will learn more about each of these individually in greater detail. As we move into some common types of fat suppression, we will look at the pulse sequence chronogram along with an explanation of the process of the technique. We will discuss the advantages and disadvantages of each, which are helpful in the clinical field to decide which fat suppression technique is best for your situation, the current situation you have with the patient. And we will discuss how each sequence technique is useful and look at a few examples of each. First is the only technique using T1 relaxation, and that is our STIR. STIR is an inversion recovery sequence where the value of the inversion time, or TI, time to inversion, is chosen such that the fat signal does not contribute to the resulting image. In this technique, note that the initial pulse applied is a 180-degree pulse. We call this an inversion pulse. The total signal, fat and water, is initially inverted or flipped 180 degrees. The inversion RF pulse causes spins initially parallel to the main field to become oriented anti-parallel to the main field of B0. The inversion time, or TI, is then selected in a way to eliminate the fat signal. Since a 1.5 Tesla, the T1 of fat is 260 milliseconds. Okay, so that is the inversion time for fat. And for most other tissues, the T1 is greater than 500 milliseconds. Therefore, the null point for the fat signal will occur much sooner than that of the other tissues. Therefore, if a standard MRI sequence is started when the fat signal is at its null point, then the fat spins will not contribute to the resulting image. They don't have any signal to give off for that image. In principle, the fat null point will be reached when the inversion time is equal to the T1 of the tissue times 0.693. For fat, that would be 260 milliseconds times 0.693, which is equal to 180 milliseconds in a 1.5 Tesla scanner. In practice, the optimal value will also depend on other sequence parameters, parameter settings such as the TR, the magnetic field intensity, typically the TI, or the time of inversion, is chosen to be less than the theoretical null point. For example, 150 milliseconds at 1.5 Tesla instead of the 180 milliseconds. We want to be sure that that fat is suppressed. That's the objective of the sequence. One of the primary advantages of our IR techniques for fat suppression is that it is insensitive to B0 inhomogeneities. Okay, so giving a signal that is dependable and accurate. It's also useful at larger fields of view, so up to 500 millimeters or 50 centimeters. So it's great for abdominal imaging, cardiac imaging when we're looking at the entire chest, those types of pelvic imaging, anything where you're using a large field of view. The disadvantages include the number of slices possible in an acquisition, because this can add time to the scan. We don't want to add time. Time will affect our fat suppression. In addition, IR sequences provide a lower signal to noise ratio, which will affect the tissue contrast. If you recall, we always want the signal to be higher than the noise in order to have a high signal to noise ratio. So a technique that lowers our signal to noise ratio is not always our best option. Another important disadvantage is that it is not useful for post-gadolinium injections because of the effect gadolinium has on T1 relaxation. I'm not saying it's never used for that, it's just not always the best. Some common applications for these types of sequences are MSK or musculoskeletal work, especially when we're looking for hypersignal of water in response to an injury, whole body imaging and detection scanning when we're looking for general pathology. Anytime a large field of view must be used because of the technique's superb homogeneity. And also with T2 weighting, where many fat suppression techniques are focused on T1 relaxation. Here we see an example of a thigh or upper leg sequence in the coronal plane. This image is done post-gadolinium contrast injection. All of the fat has been suppressed, as is recognizable by the overall darkness of the image on a typically fatty body part. Note the mass in the right upper thigh. This is well seen because of the suppression of fat. Again, consider if this were not fat suppressed, and consider that the thighs typically have a good amount of fatty tissue. This mass would possibly not be seen or not seen as well if it was hidden behind other bright tissue. All right, so the next technique we're going to talk about is spectral fat suppression. This is one of the most commonly used methods of fat suppression in MRI. Do you know what parameter that you select? That's parameter that you select that says FS or fat sat, especially if you work on GE, you know what I'm talking about. When you do that, you are applying the spectral fat saturation. When you select that fat sat option, you add that to your pulse sequence, and you might not even know it. All right, with this form of fat suppression, the fat resonance, with this form of fat suppression, the fat resonance is excited selectively, and then the signal is spoiled using gradient pulses. You might have heard the term spoiled gradient before, okay? So the fat spins are initially tipped into the transverse plane using a special 90-degree pulse that affects only the fat spins. After this RF pulse, the fat spins are aligned perpendicular to the main magnetic field, B0, while the water spins are still parallel to B0. If a signal were to be measured at this point, it would have some contributions from fat spins only. However, the spoiler gradient pulses are used to dephase the fat spins, causing the fat signal to decay to zero without affecting the water spins, which are still in equilibrium. At this point, that fat signal is said to be saturated. So that's where we get the term saturation. The fat signal has been suppressed on a standard MR sequence and can now be initiated. A standard sequence can now be initiated. The resulting image, that image that we get from this sequence in principle, has no contribution from fat spins. The RF pulse used in a spectral fat saturation must be designed to excite only fat spins. The central frequency of the RF excitation must be lower than the water resonance frequency by 3.35 parts per million, which is 214 hertz at a 1.5 Tesla scanner and 418 hertz on a 3 Tesla scanner. We know that fat and water molecules precess or spin at different frequencies. When using this fat saturation technique, a graph will appear for the technologist to determine where the fat is, where it is actually being measured. A gradient pulse can be applied at precise moment during image acquisition to suppress or spoil the fat signal and make it null. Here's how it works. After this RF pulse, the fat spins are aligned perpendicular to the main magnetic field, or B0, while the water spins are still parallel to B0. However, spoiler gradient pulses are used then to dephase the fat spins, causing the fat signal to decay to 0 without affecting the water spins. At this point, the fat signal is said to be saturated and the fat signal has been suppressed and a standard pulse is initiated. We can play and pause the animation. So when I click info, you'll see an example of what the technologist would see and how the fat and water, peaks to determine where to put the lines to be able to suppress the fat. The RF pulse used in spectral fat saturation must be designed to only excite fat spins, and the spoiler gradient pulses are used only to dephase the fat spins. Because the fat spins, causing the fat spins to decay down to 0. In this animation, we can watch the process through the pulse sequence. Notice the saturation over just the fat peak. Also notice the changes in the animated image. This is the fat saturation technique used when the operator selects fat saturation, or FS, in a standard protocol. Theoretically, all that needs done is to click the button or click the option that says fat sat. There are several advantages to spectral fat suppression. Most notable is that there is little to no increase in the scan time and that the signal to noise ratio is not affected. Remember earlier we talked about some techniques where the signal to noise ratio is affected. In addition, it is great for post-contrast injections. An important disadvantages is how sensitive these sequences are to inhomogeneities. So we've talked about pulse sequences that are not sensitive to that. For this reason, something called a shim is needed. A shim is something that is applied just to adjust the homogeneity. In addition, a good shim is difficult to apply on certain areas of the body, and some vendors or scanner types have more difficulty with proper shim applications than others. It is often difficult to get a good shim on an open scanner, for instance. So this shim that needs to be applied, which requires a preparation pulse, does increase the minimum TR and total acquisition time a little bit. Therefore, it can reduce the number of maximum slices available. In some cases, more than one shim would need to be performed. If you bring the patient out of the scanner on some some vendors, if you bring the patient out of the scanner for an injection, put the patient back in the scanner, another shim might need to be repeated after you move the patient back in. All of this adds a little bit of time. Spectral saturation is used to differentiate tissues and is particularly useful when with tissues that have varying signal next to each other or within a close vicinity of each other. This technique also helps to differentiate spontaneous hypersignals in T1, thus allowing for better characterization of tissue composition. So starting to believe I can't talk today. An example of this is blood versus fat. Both are going to be bright on T1. However, only blood would be bright on T1 fat sat because the fat has been suppressed. This technique can be useful both with T1 and T2 pulse sequences. In T1, it is most useful after the injection of gadolinium when we are looking for hypersignal from contrast enhancement. And for T2, when we are searching for hypersignal from edema. In our examples here, we have an axial slice of the pelvis 3 different ways. The first image is T1 with spontaneous hypersignal to the right of the bladder. We can see that right here, down here on the bottom left of your image. Okay. The middle image shows T1 with fat saturation, and we visualize persistent hypersignal, telling us that that hypersignal seen is not fat and it is some type of pathology. The last image is after the injection of contrast and still with fat saturation, giving us even more information about the tissue based on the enhancement and the fat saturation. Based on the enhancement and fat saturation. Probably the most significant disadvantage to this type of saturation technique is susceptibility and inhomogeneities as shown here. This was most likely caused by poor or improper shimming or not shimming at all. When performing fat saturation, the last thing we want is random bright signal. That is what we are trying to eliminate. And of course, it could cover up pathology we are looking for with these types of techniques. It could also lead the radiologist to not trust the overall fat saturation of the image. Okay, so we see some bright signal over on the side of the shoulder, over towards the, through the muscle and so forth, and even into the bone. Okay. Over here, we see some odd bright signals appearing in different places. And again, that's all most likely caused by improper shimming or not shimming the image. Okay, so that brings us to SPAIR. The next technique is called SPAIR, S-P-A-I-R, which stands for Spectral Attenuated Inversion Recovery. Another technique similar to SPAIR is SPUR. Okay, so SPUR stands for Spectral Presaturation Inversion Recovery. The biggest difference between the two is the nature of the inversion pulses, as I mentioned. The uses and the fact that the spectral saturation is used with an inversion recovery are all the same. For the purpose of this lesson, we will concentrate on SPAIR technique, but understand that SPUR falls into this category as well. So again, SPAIR, or Spectral Attenuated Inversion Recovery, is a hybrid technique combining features of both CHESS, C-H-E-S-S, and STIR. As shown in the diagram, the sequence begins with a 180-degree inverting pulse tuned to the fat resonance. This pulse inverts the longitudinal magnetization of fat so that it lies in the direction Z, along the Z-axis. Water protons are not affected. A spoiler gradient destroys any inadvertent transverse magnetization created by the pulse. Fat, with its short T1, begins to recover quickly from this inversion, and its Ti is longitudinal magnetization is 0. An imaging sequence initiated at this time would generate a signal only from water protons. SPAIR uses an adiabatic pulse. Adiabatic inversion pulses are a special class of RF pulse capable of accurately rotating longitudinal and transverse magnetization by exactly 180 degrees, even when the B1 field is spatially non-uniform. On this slide, we can see the different concentration of fat and water during the SPAIR technique. There is an initial 180-degree pulse followed by an inversion pulse at the time of excitation of the fat protons. Note on the graph that the fat longitudinal magnetization is 0 at the time of inversion, or TI. Also note the water protons are not affected. SPAIR technique is extremely useful when other saturation techniques present issues. An example of this would be a body part with varying thicknesses, such as a foot in certain planes, or a humerus on a patient with a very thick shoulder, or a femur on a patient that has a very thick thigh at the top, but with a small knee. This technique is also less sensitive to inhomogeneities and the usefulness and is very useful after the injection of contrast media. One of the primary disadvantages is increasing TR and ultimately scan time, or being limited in the number of slices possible due to the complex pulses. So for example, on a femur or a humerus, on the transverse slices, we often have a lot of slices to get the entire way through that anatomy. This is a good sequence for that because of the varying thicknesses. However, then we run into time issues trying to get extra slices or being limited on our number of slices. Breast imaging is a great place for fat saturation due to the amount of fat in breast tissue. This is an example of a breast MRI using SPAIR. There are two reasons SPAIR is a good choice for this sequence. First, the breast often has various thicknesses between the chest wall and then out towards the nipple. So we have varying part thicknesses. We know SPAIR is good for that. The second reason is the metal marker. This patient has a metal marker that was placed inside that patient after a lumpectomy. The metal creates susceptibility artifact and also does not allow for proper saturation. However, as we discussed, the SPAIR technique is a great option when proper saturation is difficult. Our next technique that we're going to talk about is the Dixon technique. The Dixon technique was created to deal with issues of non-uniform fat suppression. It is based on chemical shift. There are different ways to achieve this. The Dixon technique has several different, very distinct methods: the 2-point method, the 3-point method, and the 6-point method. Here, we're going to examine just the 2- and 3-point methods. The Dixon technique was discovered or realized in 1984 by a physicist named Dixon, who proposed that a chemical shift imaging method using the in-phase, out-of-phase cycling of fat and water. The chronogram that we see here explains the Dixon technique, which consists of acquiring 2 or 3 echoes on each line in order to make fat saturation calculations. You may know this sequence from clinic as the in-phase, out-of-phase sequence. It is very commonly used for abdominal imaging. In the chronogram that we see here, we have an RF pulse with a bipolar slice selection gradient, at the same time as the bipolar frequency encoding gradient and the phase encoding gradient. There are then 3 frequency encoding gradients. one at the cut time, which is 2.38 milliseconds on a 1.5 Tesla scanner, one at the in-phase time, which is 4.76 milliseconds on a 1.5 Tesla scanner, and the last one at the out-of-phase time, which is 7.15 milliseconds on a 1.5 Tesla scanner. Modern Dixon methods combine 3 echoes acquired at different TEs to create water-only and fat-only images. This technique is relatively insensitive to B0 and B1 inhomogeneities. The basic idea behind Dixon's technique can be explained very simply on this slide. First, we take the principle of the precession of different tissues at different frequencies and use that principle to record the chemical shift of those tissues differently. On the slide, we let IP represent the signal intensity of pixels from the in phase. So IP stands for in phase image, okay? And then let OP represent that of the out of phase image. So OP equals out of phase. By definition, in phase will equal the signal from water plus the signal from fat. When we were out of phase, we would subtract the intensity from subtract the intensity of fat from water, or vice versa, depending on what we want to see. In other words, if we subtracted the signal of fat from the image, we have fat suppression. If we subtract the signal of water from the image, we have fluid suppression. As mentioned, this is a simplified description of the technique. We will see later on a later slide a more detailed description of how it is accomplished. Dixon technique, as mentioned, is based on chemical shift. If you recall, fat and water have different resonance frequencies. We use this here to our advantage. Water and fat are in phase when the phase difference between the two of them is 180 degrees. The phase, meaning the phase is opposed. This is produced at this is produced at each 2.4 milliseconds in a 1.5 Tesla scanner. So after 2.4 milliseconds, a 180 degree phase difference exists between the water and the fat spins. At 4.8 milliseconds, which is another 2.4 milliseconds, the lipid signal or the fat signal and water signal are again in phase. The phase difference between them is 0, and so on. With the Dixon method, both in phase and opposed phase or out of phase images are acquired. The first one with the fat and water spins in phase, and the other one with them out of phase. If the two images are added together pixel by pixel, the result would be a fat suppressed image, meaning that only water signal remains. We are basically adding the in phase and the out of phase image together. Conversely, if these images are subtracted, the resulting image will be water suppressed and only fat signal would be remaining. We are subtracting the in phase and out of phase, or the in phase minus the out of phase is a better way to put it. Dixon offers up to 4 contrasts in a single measurement. Images in which water and fat are in phase opposition, images of pure water, and images of pure fat. Okay, so remember, we have the in phase image, we have the out of phase image, and with those two, we can create a water image, an image that shows only water and suppresses fat, or an image that only shows fat and suppresses water. The slide shows how the pure water and pure fat images are acquired. Water is represented by the blue arrow and fat by the yellow arrow. As mentioned a few slides ago, this is a bit more complicated than the simple explanation. In the formula, W and F are the signal contributions from water and fat, respectively. By averaging sum and difference data from each point, pure water and pure fat images can be reconstructed. In this example, 2 acquisitions using spin echo are performed. In the first, water and fat spins are in phase, that's signal 1. In the second one, they are out of phase, that's signal 2. To obtain this signal, signal 2, the time of the application of the RF pulse, or the inversion pulse, should be modified so that the center of the reading gradient is shifted about 2.4 milliseconds. The 3-point Dixon method is very similar to the 2-point Dixon method, except that an extra image is required where fat and water and fat spins are dephased by an angle that's equal to half of pi, 2 of pi. This third image is used to correct for miscellaneous phase errors. The first and third images should have the same phase behavior, and any deviation from this will be due to B0 inhomogeneity. The phase error can be determined from these 2 images, and the correction is applied to in-phase and out-of-phase images. These corrected in-phase and out-of-phase complex images are then added and or subtracted to get fat and or water suppressed images respectively. For the 3-point technique, 3 echoes are acquired: in phase, out of phase, and in phase averaged of all in phase echoes and reconstruct identical images. Recall the case of ideal on GE. So IDEAL, it's an acronym for a pulse sequence. So when using ideal on GE, uses 3 echoes and a specific algorithm to reconstruct 4 images: in phase, out of phase, water, and fat. We can see these 4 echoes here on the MRI of the knee. So if you look at the bottom, we have the water only, we have the fat only, we have the in phase, and then we have the out of phase. Dixon technique is most useful when providing images of up to 4 different contrasts when that's desired during a single acquisition. It does save time. It allows you to obtain 4 different contrasts in one acquisition, which saves time for your imaging. This includes the popular applications of MSK or musculoskeletal imaging and also abdominal imaging. It's also useful when inhomogeneities are of concern. The advantages of this technique are its insensitivity to inhomogeneities and its usefulness after the injection of contrast media. The primary disadvantages are an increase in acquisition time, as a longer TE is necessary for the addition of contrast acquisitions. I want to go back to what I said on the previous slide. If we were to do all 4 sequences separately, that would definitely add a lot more time than what's added for this particular sequence. There are also often errors in image reconstruction. So remember, we have an in phase and an out of phase. We're using those to create a water only or a fat only image, and they're reconstructed images, and sometimes there can be issues with the reconstruction. Here we have an example of an axial slice of an abdomen. As I mentioned, the Dixon technique is very useful on abdominal imaging, mostly because we're able to acquire 4 separate acquisitions in one acquisition. The likelihood, why this is so good is because the likelihood of having the patient breathe the same on 4 separate acquisitions is nearly impossible. And if you've done enough abdominal work, I'm sure you know what I'm talking about. First image, the first sequence, the patient takes in a nice deep breath on the images. The next time, not quite so much. Next time, not quite so much. And every time you look at the images, the liver's in a different place. Using the Dixon technique, in one acquisition, we have our in phase, our out of phase, our fat saturation, and our water saturation set of images. Each of these is labeled so that you can get a better idea of how they appear. As mentioned, one disadvantage of reconstruction is error. In our examples, we see see an error on the edge of the liver and in the body of the spleen. So notice the arrows pointing to this area that didn't reconstruct properly in the liver, and then also here in the spleen. Okay. Note that this only happened on the saturations. The in phase and out of phase are fine. That's what lets us know that that is in fact a reconstruction error and not some type of pathology or variance within our patient. Okay. So the next thing we're going to start talking about is water excitation as a way to suppress the fat. Okay, so fat suppression can be done by exciting the water spins and only the water spins and leaving the fat spins unaffected. This is normally achieved by using a special type of RF pulse known as a binomial pulse separated with very precise delay times. In order to understand how this technique works, we're going to present two examples of binomial pulses. A binomial pulse 1-to-1 and binomial pulse 1-to-1-to-1. Okay, two different terms there, but they sound the same. Okay, so in selective excitation of water by a binomial pulse 1-to-1, we have two 45-degree pulses. The first 45-degree pulse causes both vectors, the water and the fat vector, to be tipped partially towards the transverse plane. Next, we have dephasing spins. Fat and water vectors will be exactly 180 degrees out of phase. At this time, a second non-selective RF pulse is applied. We can then notice that the second non-selective 45-degree pulse will rotate the fat vector back to its original position along the z-axis, while rotating the water vector entirely into the transverse plane. Therefore, we're left with only water spins participating in the formation of the resulting image. While fat spins are back at their original position, which is parallel to the main field, we have no effect. The fat has no effect on that resulting image. The combination of two non-selective 45-degree pulses, therefore, had the same effect as a single frequency selective pulse of 90 degrees, or the water excitation pulse. Okay. Selective excitation of water by a binomial pulse 1, then 2, and then 1 gives us three pulses. The first one is 22.5 degrees. The second one, 45 degrees. The third one is 22.5 degrees. In this case, after the application of the three RF pulses, the net tip angle for the water spins is the sum of the three tip angles. If you add them together, 22.5, 45, and 22.5, you have 90 degrees. While fat spins return to their original position, which is parallel to the main field, and do not participate in the resulting image. This slide shows a minimum excitation of fat-bound protons and a maximum excitation of water-bound protons. Notice that when the order of the binomial pulse is higher, fat suppression is better. This is referred to as spectral excitation profile. I'll give you a second to watch. I don't want to, it's a short description, but I want you to be able to see that. I want you to be able to see what's happening. Okay. Just watch it one more time. If you're like me, I like to get the visual. I can listen to stuff all day long, but the visual helps a lot better. And that one's almost done. We're dephasing, and then that 22.5 pulse, okay? All right, so let's move on to the next slide. Water excitation is very useful in arthrography MRI studies. So that's an examination where the patient is injected with gadolinium under fluoroscopy and then comes to MRI for a study. It's also useful when performing 3D MRI and fat saturation is needed. So sometimes abdominal work, some other areas where 3D MRI is performed. Another example would be the wrist, 3D images of the wrist, especially under arthrography. Also very useful. Advantages of this technique are that they require no extra RF pulse and no spoiler gradients. This technique results in minimal TR and acquisition time increases. So again, remember, that is without making any other changes to your parameters. Additionally, because no extra RF pulses are used, there are less SAR problems. So SAR is our specific absorption ratio. This technique is also applicable when contrast agent is applied. Disadvantages are that a good shim is necessary because inhomogeneities are an issue, and manual adjustments to transmitter frequency are necessary often. Water excitation is a chemical shift dependent method, making it a little less desirable as well, because we know we don't always have success with chemical shift. Sorry about that. That was the for the last slide. So let me go over that again since I was on the wrong side. Advantages of this technique are that they require no extra RF pulse and no spoiler gradients. Results in less TR time, less acquisition time increases, less problems with SAR because there's no extra RF pulses. And it's good when contrast media is used. Disadvantages are that we have to be very good with our shimming, and a good shim is necessary because of the inhomogeneities. Manual adjustments to the transmitter frequency may be necessary, and it is chemical shift dependent, which makes it less desirable. Okay, now let's go on to the next slide. On this slide, we see a 3D sequence of the elbow using water excitation technique. Notice the detail and contrast of this sequence. I'm going to go through that entire set of images. I'm going to let it run a couple times so you can get a good idea of what this looks like. We have superb detail, especially in the contrast resolution. As we can see within, I can't pause it. It's not going to let me pause it, but in the joint space here, we can see great contrast resolution. Okay. All right. I'm going to go ahead and go on. As promised, the fluid suppression technique of FLAIR will be discussed next. If you recall, the Dixon technique discussed earlier provided the ability to suppress water or fat. The FLAIR, on the other hand, can only suppress fluid or water. The parameters to set for this FLAIR sequence, FLAIR, are the same as they are for the FSE, or the fast spin echo IR, or turbo spin echo IR sequence. Okay, so it has an IR in there. We see the IR at the end, FLAIR, tells us that it is an inversion recovery sequence. There's a simple rule that must be followed. The TR must be 4 times higher than the time of inversion. The time of inversion, or the TI, is set to suppress the water signal, which is between 2,000 and 2,300 milliseconds on a 1.5 Tesla scanner. Although this sequence can also be set to furnish T1 weighting, it is used primarily for T2 settings. So yes, a FLAIR can be used for T1 imaging. It's just more common with T2. In addition, as shown on this slide, if we move the horizontal line, so if I grab this bar and I move this across, the excitation profile of the first 180-degree pulse is much larger than the desired slice. The goal is to ensure that circulating cerebral spinal fluid is correctly saturated at the moment of the 90-degree pulse. So let me go back to the beginning again. Let me slide that across for you, okay? So we can see what happens at the pulses, right? Each pulse, 180 degrees, another 180 degrees, another 180 degrees, and then our echo, okay? And I think I said that. The goal is to make sure that the circulating CSF is correctly saturated. CSF, which is located in the slice at the moment of the 90-degree pulse, was not in the slice at the moment of the 180-degree pulse because it's moving. It's just like vascular flow. Because the cerebral spinal fluid is constantly moving, it's not going to be in the exact same position on your 90-degree pulse and your 180-degree pulse. Since the excitation profile of this initial 180-degree pulse is broader, it was still subjected to the 180-degree pulse. When using T2 FLAIR imaging, it's recommended to have at least a TR that is 4 times the time of inversion, and to be in a double, and also should be in a double acquisition or more, meaning not a single acquisition of collection. The technique used to suppress fluid in inversion recovery sequence, called FLAIR. FLAIR stands for Fluid Attenuated Inversion Recovery. The FLAIR sequence is a special sequence and a special type of inversion recovery based on the fast spin echo. At first look, the shape of the time diagram or the chronogram is identical. The difference in reality involves the excitation profile of the first 180-degree pulse. This is why the time diagrams, which do not take excitation profiles into account, are identical. We will examine this excitation profile in the slide parameters. We can note the shape of slice selection gradients are bipolar for the 90-degree pulse to compensate dephasings, and are not bipolar at the moment of the 180-degree pulse when it is applied because of the inversion of dephasing induced by the pulse. Frequency gradient is composed of 1 positive lobe for the 180-degree pulse and 2 positive lobes after the 180-degree pulse at the moment when the signal is read. Here, if we scroll the bar, we can visualize movements. You can see the red line going across. We visualize the movement when the signal is read, okay? Notice on the other side, we see K-space filling. So we see how much K-space is filled with each TR, okay? Therefore, acquisition times are much shorter as rows are filled at each TR. This is why this sequence is faster than spin echo inversion recovery. So the fluid attenuated inversion recovery versus just a straight inversion recovery sequence, okay? The number of rows of K-space filled at each TR is a parameter that can be set using the echo train or turbo factor. Okay. So I'm going to click on the film strip and we're going to take a look at that. See how we can visualize this sequence over several TRs. One of the things I like about the work they do at Medical Professionals are their graphics. They're actually really good. Okay. FLAIR is compatible with both the 2D, two-dimensional, and three-dimensional models. Here we see the three-dimensional model, which works in much the same way as the two-dimensional model. So again, I'm going to scroll the bar, and you can note the movement across the chronogram, and also note the filling of the case space on the right-hand side. Okay, so as I move the bar across, we're able to see that. Okay, now we're going into another excitation. Okay, let me click on the film strip, and we'll look at that as a complete set. Okay, very good. Another great visual. Okay. The FLAIR sequence is the reference sequence for neuroimaging. You can't really do a complete brain imaging if you don't include a FLAIR. Especially when we're looking for MS. FLAIR is great at visualizing lesions such as demyelinization plaques in the white matter, which are common with patients with certain types of autoimmune disease, but particularly multiple sclerosis. It is difficult to disassociate junction regions, often involved in inflammatory processes from ventricles and hypersignal when fast spin echo or turbo spin echo T1 weightings become visible in FLAIR because of the suppression of the signal from the CSF inside the ventricles. This FLAIR sequence has advantages of suppressing the CSF signal and is relatively insensitive to flow artifacts. The excitation profile of the first pulse saturates CSF even though the fluid circulates. This sequence is generally used in T1 weighting, but can also be set to furnish T1 weighting. Pay attention to these settings. That must be avoided if contrast is sought. Okay. The major disadvantage of this sequence involves its acquisition time. It is recommended to run the sequence as several acquisitions because of the broader excitation profile of the initial 180-degree pulse. Total sequence time for FLAIRs can actually be fairly long. And that would probably be our primary disadvantage. On this slide, we can see several examples of images obtained with FLAIR sequence. As we have previously seen, this sequence is the reference sequence for neuroimaging. So I'm going to drag these into the box so you can see them a little bit better. The first image we have is an axial T2 FLAIR EPI, which is a sequence used in brain perfusion scanning to diagnose pathology. The next two images, I'm going to pull one over, okay. This image and the next one after are both images showing an axial T2 FLAIR. This sequence is common in brain imaging, especially to help identify small lesions hidden by the fluid content of the brain. As I mentioned, an example of that would be multiple sclerosis. Now here we see a patient that has a hematoma or a bleed. I'm not sure which one that would be without having a background. This is the other image, the other axial that's taken. And again, we look to see small lesions, small demyelinizations within the brain. Okay. The last image is a sagittal T1 FLAIR. I want you to note that both T1 and T2 sequences can run with the FLAIR water suppression technique. So this is what a T1 FLAIR would look like. And it's going to run through the entire sequence for you. So it has a little bit of a different appearance than what we saw on the T2 FLAIR. I'll let that run for just a second so you can get a good look at it. Okay, very good. All right, that brings us to our last topic. So in our last topic, we're going to cover saturation or suppression that is selective in nature, and that's the use of saturation bands. And if you've been working in MRI, you've probably used saturation bands for a couple different things, and we're going to talk about that. All right. So in order to saturate all of the tissues in a given zone, we use a technique similar to that of fat saturation. It involves the use of a selective pulse applied before the sequence. So if you remember when we talked about just the plain fat sat that you add to your sequence, that is a selective pulse that's added to your sequence. We have chosen the simplest sequence here for demonstration. So we're just looking at your basic spin echo. We apply a slice selection gradient to make the protons of a precise section of the anatomy resonate. The RF wave applied covers all of the rotational frequencies of the hydrogen protons in that section. All protons in the section are flipped 90 degrees and the others are left untouched. We now apply the standard sequence. Protons inside the pre-saturated band will not have a transverse component, and therefore they cannot give a signal. These pre-saturation bands are called SAT on GE, REST slab on Phillips, or REG slab or registration slab saturation on Siemens. Here we have, so let's, this is our initial 90 degree saturation pulse that we're going to apply. That's our selective saturation pulse. We're going to apply that and then go right into our normal 90 degree initiation pulse on a spin echo. Here we have the echo. Here's another 90 degree pulse. Okay. So we apply the saturation pulse, apply our 90 degree pulse, and then collect our signal. We get no signal where the pre-saturation band had been applied. Here we have an example of using saturation bands to eliminate involuntary motion. The venous flow in the back of the brain is causing an artifact on the first image. Without the saturation pulse, we can see the artifact the entire way through the brain. This is caused by the pulsation of the venous anatomy, the venous flow in the back of the head. Okay. On the second image, we see a dark band. That dark band is our saturation pulse. Okay. This is that pre-saturation pulse band. It works along the same principle of the gradients. The protons in this area, in that dark area, will not precess at the same rate as the rest of the protons in the image. Therefore, they do not contribute to the signal. And the motion created by the signal is also not as noticeable. Now, we have not gotten rid of that motion completely. It is still there, but it's not as noticeable, and it does help with the image quality. Fat sat and pre-saturation bands operate with similar mechanisms. They use a selective pulse just before the sequence is applied. Fat sat sends a selective pulse to the entire volume, but at a very precise frequency by adjusting the emission bandwidth. Pre-saturation sends a selective pulse over all frequency, but creates resonance at a precise location by using the section selection gradient. And I want to go back for just a second because I honestly thought there were more slides on this. I just want to talk about this just a little bit more. There are some other areas where we use this. If you think of 3D images, like a time of flight image, we use saturation pulses. Let's say we're doing an arterial study of the circle of Willis. We put a saturation pulse at the top of the head so that the venous flow doesn't contribute to the image. If we were doing a venous study, we would put the pre-saturation pulse below the head so that the arterial flow isn't affecting the image. We also can use pre-saturation pulses when we're talking about breathing motion. So for instance, when we're doing a cervical spine and the patient is not going to be able to hold their breath for a 3 or 4 minute acquisition, right? So we put a band in front of the cervical spine over the trachea and over the esophagus. So when the patient swallows and when the patient is breathing, that's not affecting our image quality, okay? So those are just different uses for those types of saturations. Are they useful to saturate water, to saturate fluid? No, they have very specific uses. Most of it has to do with, I don't want to see this in my image, and I want to suppress what's causing it, and use of the saturation pulses will be able to do that. All right, so we've covered a lot of material, right? We talked a lot about MRI, and sometimes talking about MRI is like talking a whole nother language. I've always said that it's a whole nother language to learn to understand. And we talked about lots of different saturation techniques. There are more out there. There's a lot more to talk about in this area. Okay, saturation is basically the use of imaging tools and techniques to suppress or turn off signal from certain types of tissue. We also learned that saturation bands can be used to hide imperfections or undesirable elements of an image. Some examples of that might be motion or flow. There are two basic types of fat suppression that we talked about. Okay, we talked about the use of T1, particularly STIR, the use of resonance frequencies, such as spectral suppression, SPAIR, Dixon, water excitation. And we talked about the times that fluid and water needs to be suppressed, the time setting that the fluid water needs to be suppressed using inversion recovery with something such as FLAIR. Okay. I want to go back over our objectives. I want you to read over these, and I want to make sure that you are now feeling comfortable, or you're able to define the term suppression and how it relates to MRI, that you feel comfortable listing different tissue types which are commonly suppressed in MRI, and really there's only two very common. We also talked about very common saturation techniques: fat suppression, fluid suppression. We talked about being able to define saturation bands and what they're used for, and also being able to list and explain different ways that saturation bands are used. Okay, I thank everybody for their attention. I really enjoy doing this, but other than that, we gave you all the information we promised to give you, and hopefully gave you some insight into some techniques that you're able to use in clinic, or maybe some explanation. We work with stuff all the time, and it's like, I do this, I don't understand exactly how it's working. So it's always great to be able to reach out and hear those things.